John Doe Radio Show.
With the latest local and national marijuana news and entertainment.
One stop for your stoner fix.
Welcome to the John Doe Radio Show. I'm your host, John Doe. Thank you very much for joining us this week. We will update you with news from Maine. That one, a very frustrating story, and we'll go off on that here in just a minute. New York adds PTSD to a list of qualifying conditions for medical marijuana, mislabeling of potency, and why it's becoming a bigger issue, and why it's been kind of a big issue and just not talked about, or attention has been drawn to it because of testing and not necessarily regulation, but how companies have not wanted to share information between each other. It's kind of held things up and created a few hurdles for us to progress on. The FDA says, fart your couch when it comes to CBD and quit making the claims that it cures cancer. Las Vegas has a social use update that we'll get to, and a Massachusetts update. All that and the analysis of these articles that you've grown to love from JDR. We've also got to take a moment to say congratulations to Colorado on their 5-year canniversary. 5 years ago, voting to legalize recreational marijuana. It's been a lot longer of a fight with medical marijuana and all that stuff, but it's a fantastic milestone. I got to go to a couple events, see some fantastic people that I've known from the beginning of all this craziness and haven't got to see for a while, and touch base with them, so that was fantastic and exciting. Kind of rejuvenated the blood a little bit for being an activist and continuing this fight. So once again, if you would like to experience what we've experienced here in Colorado, you can do it too. Just takes a lot of hard work and you screaming at the top of your lungs to get it done. All right, so maybe it's a little bit more difficult than that, but it can be done. It's been proven multiple times. Let's get to it this week. It's the JDR.
It's the John Doe Radio Show.
How much higher can you get?
I'm out here trying to make it. Woman, can't you see? Takes a lot of money to make it. Let's talk truthfully.
As we grow with JDR and get back into adding more and more segments and maximizing the education we can here on the John Doe Radio Show, I want to make sure it reaches as many people as possible. We never really put money into advertising or put ourselves out there in regards to something like the Facebook advertising that exists today. Namely because advertising at that level for that affordability didn't exist even a few years ago. So what we would like to do is, as we grow this program, continue to add these segments, better educate people. We want to make sure that we make it available to as many people as possible. So we will start to put money into advertising, mainly, particularly on Facebook. So if you would like to be a part of the John Doe Radio Show, or would like to help support us in that, and even if you would just like to put a product on the John Doe Radio Show, if we approve of it, we can't necessarily put it on if we're going to tear it apart. I mean, we will. We'll put it on and we'll tear it apart if it's a bad product. But I want to bring good products. If you have something that you would like to give away, you would like to present us here, email me, johndoeradio@gmail.com. We'd love to have you part of the family. We'd love to get you involved in this. Help us grow our product and help you grow your product too. johndoeradio@gmail.com.
The John Doe Radio Show.
Easily one of the most frustrating stories over the past couple of weeks comes from Maine, with Governor Paul LePage's vetoing of a bill that would have created legal framework for retail sales of recreational marijuana. Now, not only is this frustrating because of Governor LePage vetoing this bill, the one man standing in the way. We've talked about that a lot before on JDR. Vermont actually getting a new governor so they could see strides forward that they've been looking for in Vermont for years and years and years. New Jersey, which we've talked about, and we will talk about a ton more coming up here. That one kind of blindsided me. I was just fascinating how some of these things can change with just the snap of a finger, with the vote of the people. Change of guard can actually get something done. Wow, what a concept. It's exciting and it's awesome. And so when we see things like Vermont, New Jersey, it is a very encouraging thing. It's awesome to see. But then we're running into the situation in Maine where it's like running into a brick wall. Every state who has legalized or has a robust medical marijuana system has put in regulations and has been through this. It's hugely important to the process. It gives everything legitimacy. And back to the story, actually, we'll ramble on too much. The bill was a result of more than 9 months of work in Maine by a special committee tasked with implementing a law that voters narrowly approved last November, putting Maine among the 8 states and the District of Columbia that have legalized the adult use of marijuana. The 74-62 vote on Monday, we're talking about the vote to overturn the veto here. This past Monday fell 17 votes short of the two-thirds margin required to overturn LePage's veto. The path forward for the ballot box law remains unclear, with the current moratorium on recreational sales expiring February 1st. The legislature reconvenes in January and could pass legislation then, but it's uncertain whether the political dynamic will change enough in the next 2 months for implementation of laws to be passed or a moratorium to be extended. If neither occurs, the ballot box law would take effect, a prospect that some lawmakers find alarming. I talked with a few people from Maine who were not entirely happy with the bill that would have passed had it not been vetoed, and I can understand that. Anywhere there's been regulation, our side is not going to be happy with some of the overreach that happens with this regulation. But vetting it through the public, having it play the game, is a whole part of the process. It's an important part of the process. And what I mean by playing the game is, it's gone through public committee, it's gone through public opinion, the 9 months of committee work that they did with this Maine bill. That's what I'm talking about, is that there was time to rally the troops and put forward your best effort. That is one fight. Completely separate from that fight is having the governor come in and shove everything completely aside. If you're overly stoked that this bill didn't go through because LePage vetoed it, that, in my opinion, is the wrong reason to be stoked with this bill crashing and diving. Because this is not going to get solved at all while he's still in office, it seems like. He's completely hit a brick wall with this. So no matter what work you do behind the scenes at this point in time to push this forward during his reign, for lack of a better term, the one thing that came to my mind there, until he leaves office, it doesn't look like that this is going to get taken care of. So that's a frustrating part. It frustrates me to hear people cheer that this didn't succeed because that is the end result. So maybe I'm being a little bit touchy and picky with that, but I think it's important that we measure our victories and our losses. And seeing how that this already went through the process, played the game, was about to be implemented, and then boom, got smacked out. That to me, that's a sour taste if there are people championing the side of it being crushed. That's frustrating to me. So anyway, too sidetracked here. We'll get back to it. Path forward for the ballot box. We already talked about that. Here's some of the frustration and comments from state legislators. I feel we have legalized gasoline, but not gas stations, said Representative Martin Grauman. Senator Roger Katz, a co-chair of the Special Legislative Committee that wrote the implementation bill, is unsure what the next steps will be. He said, 74-62 is a good victory in a basketball game, but it's not enough to overcome a veto. He said that after the vote, we will regroup and we will sit around and try to figure out where the heck we go from here, and I hope somebody has some bright ideas because right now, I don't have any. That paragraph right there, if you do not understand the frustration from that lawmaker in that paragraph and the frustration with what can you do at this point when this governor is not going to allow any of your work through, what do? What you actually do, and this is something that I thought about while reading this article, is, as I mentioned before, I'm not saying that none of your hard work is going to go through. None of your hard work is going to happen. In fact, now's the time, behind the scenes, rallying the troops, strengthening your support with some of these lawmakers. That's an important thing because once LePage gets out of office, then you slide in, have a bill that you enjoy, and make that happen. So I'm not saying you're completely screwed at this point and to stop working. That's not at all what I'm saying. Not at any point in time, I will never tell you to just stop working and put your head in the sand. That's not going to happen. I will give you a reality and say, this is what I think may or may not happen, or you're wasting your time on this energy because maybe you're not looking at the bigger picture, or actually, that's some of the most frustrating parts of being in reform or working with some activists is that they're kind of removed from reality on some people on multiple different levels. And I've been there too. I understand this. You have a hope, you have an idea that's buried deep inside. You want to see that reality happen in some sort of way. And we all want to see the reality happen in our lifetime. Much less this moment. We want to make it happen in our lifetime. Sometimes it just can't happen because of how the world works. And politics is one of those frustrating things that until you've actually seen how it works, been on the inside, gotten frustrated, quit, come back, gotten frustrated, quit again, come back, you can't, I don't know what the best way to put this is. You can't be so disconnected from reality that you don't see how the system works and how the game is played. That's the whole point I make in a lot of this. Not to discourage you, but to say, hey, look at this reality, and where do we jump from there? But I ultimately, I guess where this rant really stemmed from was hearing a couple people in Maine cheer because this bill had been defeated and you're going to come back to the table next year and be able to fix it. That's not the case. Until this dude is gone, we're farked in Maine, dudes. Back to this article. Let's finish this up. Katz said the bill, as passed by the 17-member Special Committee on Marijuana Implementation, which remains an active committee, was crafted with the state's voters in mind. We recognize that almost half the people of the state of Maine voted against this, so at every turn we made a conscious effort to keep this bill as conservative as possible, which I can understand. That's why you're frustrated with this bill, because it's conservative as possible. But when you look at the alternatives of not having it implemented at all, go back. Does it pass the business model? Is it going to be something that is sustainable for Maine? Is it something that's going to be sustainable in that market for at least past the foundation stage? Will at least build a business and a model that you can prove works, and then maybe come back to the table later to try and fix what you've done, which I admit that's hard to do. It really is, but it happens, and it can happen, especially loosening some of these more ridiculous rules that are put out there. Can it at least pass the business model? Will it be successful as a program? And if it will at least be successful as a program, then let's work with that. Let's move forward with that. And how you know it's going to be successful as a program is you look at states like Colorado, Oregon, Washington, and what they've done there and the models there. And there are a few little things that stick out that tell you, there are huge red flags that will tell you this is not going to be a successful model here. You have taxes, which are becoming, inside a successful model, what can actually derail that model and create larger black market. Story after story after story coming out of California about that could be the problem there that Californians are seeing, that could, be a really big thorn in the side of regulation there is how big of taxes are happening. So, I get it. I understand. It's frustrating to have to deal with the drug warrior side of things and have them come in and try and throw us off. But the point being, if it's still going to work in the end, you're still going to have a successful business model. Let's get that in play. Let's work with it. Ultimately, my end goal in saying all this is that we move forward with enough states and enough momentum that the federal government comes in and regulates it for everybody across the board, because that's the next thing that we're going to see. The next massive hurdle for states that have already regulated, have a comfortable program in place, we're going to have to deal ultimately with federal regulation of this whole thing. Now, who knows how far down the line that's going to be, so it's important that good rules do come into place in some of these states, but ultimately, what are we willing to deal with to get it into place and to move momentum forward? And that's the biggest argument with activists across the board. I can understand that, all right? And I get it completely, that you want to have something that works for the people there and protects the people that have built the system and doesn't fail altogether business-wise. I get it. Among its provisions, the Maine bill would have required those licensed to sell recreational marijuana to be Maine residents and mandated that companies set up to produce commercial marijuana have majority Maine ownership, prohibited sales via the internet or at drive-thrus, and set up a tax structure that included money to increase the number of drug recognition officers in Maine law enforcement, an effort meant to prevent and prosecute illegal impaired driving. That's another example of one of the things that, to a point, we just have to settle on, that there is going to be a ton of money going into diversion, going into law enforcement, unfortunately. And to me, a lot of it is completely wasted. It's unneeded money that's sent off to these law enforcement agencies to do with what they will, to basically waste and persecute us back with and continue these BS drug war stories, the lies, continue the lies. That's what frustrates me, is if I can understand if a lot of this money was used in ways where weed caused problems, not in ways where you're going to build rat cages and waste $10 million of our money here in Colorado to try and, straight people away from being lab rats and testing out legalized marijuana in the system here. It's just silly. That's what's the frustrating part about money going to law enforcement and on that side of things. Now, that is how you can fight that side of it, is hold them accountable to where the money is going, hold them accountable to these ridiculous programs, and make them spend it on programs that actually work or are better, than I use the rat cage example all the time because it's the most ridiculous thing that we've done here in Colorado in a long time. If you don't know what I'm talking about, Google marijuana rat cage Colorado, and there'll be an article that will explain to you the waste of money that was. And it was a diversion program. Money used to try and get people to not use cannabis. If you're going to do it, at least be honest with people. In Colorado, we learned, or at least the state regulators learned, that you're just going to have to be upfront with people and tell them the honest-to-God truth about weed. And that's what they started to do here in Colorado. There's a campaign that, if you want to look it up, it's called Good to Know. And it basically lists off all these facts and tips on operating with legal marijuana and medical marijuana in Colorado. And a lot of them are pretty on par. There's nothing really reefer madness crazy in almost any of the Good to Know campaigns now, because we've gone through such a big process here in Colorado of holding these people that make up these crazy ads and these programs to a higher standard, and change this ridiculous drug war conversation that we have that nobody wants to listen to. It's not helping anybody. I mean, the kids are not stupid. They have access to the internet. They see that what you're telling them is a bunch of BS, and it makes them question anything else that you have to say. And we don't want to do that. We want to be honest. We want to give you the facts. So again, I use that as an example of we went too far here in Colorado, or we went too far in one state and had to reel it back in a little bit. This co-chair of the committee in Maine, Senator Roger Katz, goes on to say, by failing to pass legislation, we are driving people to the illegal dealer on the street. Although Maine was among the first states to pass a medical marijuana law, the drug remains illegal at the federal level, a key reason that LePage cited in vetoing recreational regulation measures which passed the legislature in October with bipartisan support. In his veto letter, LePage also said the bill sets unrealistic timelines for launching the market, fails to address shortcomings in the medical marijuana program, creates a confusing regulatory system, and might not generate enough tax revenue to cover the cost of market implementation or regulation. In short, he dismissed the bill as risky, inconsistent, and expensive, an expensive rush job. Again, everything ridiculous about the concerns he listed off are that there are already successful models in Colorado, Washington, etc. It's frustrating because it just echoes that drug war mentality. While campaigning for re-election in 2014, LePage said if voters approved legal marijuana, he would support that decision, but he backed away in his veto letter, writing, "Until I clearly understand how the federal government intends to treat states that seek to legalize marijuana, I cannot in good conscience support any scheme to allow state law to implement expansion of legal marijuana in Maine." The interesting part about that is I saw in another interview he had talked about if the Obama administration was still in play, then I would probably let this go through. And you can't take what this guy says for word at this, at least, and it probably with almost everything else. I would be extremely concerned because this raises a red flag to you voters in Maine. I mean, if this is the guy that you have in charge, this hypocrite in charge, you need to replace him. We need to get him out. I don't care if he's a Republican, he's a Democrat. Not sticking to your word. The Obama administration was still in play. I'd put it in. Nope. Oh. It's so frustrating to have one or two people stand in the way of progress. Thankfully, less and less, more and more, we're seeing people like this be booted out. The moratorium extension fails. In a floor speech on Monday, House Minority Leader Ken Fredette, a key LePage ally in the legislature, said that regardless of the outcome of the override vote, it was unlikely that retail sales of recreational marijuana would have begun before the moratorium expires in February. He called on lawmakers to extend the moratorium to provide time for the administration to do rulemaking that establishes details of retail licensing and a tax regime. Fredette suggested that the legislature try to move on that extension this next Monday, but Democratic leadership rejected that proposal, deciding to allow the issue to wait until January. The vote today to sustain the veto is really a vote to have us maybe even work informally over the next 60 days, but really to come back in 60 days and have it positioned in here where those issues can be addressed in a timely fashion and in a fairly short fashion. We can pass something that we can have a consensus on with this really important issue, he said. He also said one important issue for the caucus was extending. We already said that. There's no way rulemaking is going to be done in time for February 1st. This article also talks about how investors for companies in Maine, people that were already about ready to set up shop, are bouncing, that they're going to go somewhere else. And it makes perfect sense. And it's frustrating that Maine is not going to get to see the benefits of full legalization, of a fully regulated market. I mean, you think your dealer down the street's going to pay taxes? I don't think so. I mean, you're missing out on billions of dollars in this situation. Billions of dollars.
John Doe.
Sometimes you just wake up to a gift. Kind of like Christmas or another holiday where you got gifts as a kid. And if you didn't get gifts on Christmas, then I don't know what to say because I can't go back and give you the gifts for Christmas that you missed when you were a kid. I can't say I'm sorry. Maybe we'll just move on to this gift that was given to us from New Jersey. I had absolutely zero clue that Chris Christie could actually get tossed out because I'm not paying attention to New Jersey's governor race. It's hard enough to keep up on all the cannabis news across the nation, the main cannabis news, and stay plugged in. I have a full-time job outside of this, but I do have to say that I try to stay as plugged in as possible and my ear to the ground as much as possible. And you would think that maybe you would hear some echoes of change in New Jersey or this is going to happen there, and you do sometimes. Most of the time you actually do. Because a lot of the time what we're trying to do here with cannabis reform is a slow rollout, a process that takes a little bit of time. It's not something you wake up the next morning and boop, New Jersey may legalize weed in 100 days. I about fell out of my chair when I saw this news story. Like I said, no clue, first of all, that Christie could be booted out and out of the game. And then second of all, and I'm sorry to say this, but I'm not really looking at legalization movement too much on the East Coast, even though, we got Maine, Massachusetts, other states that are moving forward with it. Maine, kind of disincluding them, in some of this talk, though, because of the governor there. You got to work on that damn governor, booting him out of office so you can move forward, Maine. But it just wasn't something that I was focused on, and I feel bad for it because I feel like it's something that was hugely missed and should have been talked about. But I think a lot of people were caught blindsided by this. Democrat Phil Murphy was elected last Tuesday as New Jersey's next governor. He vowed on his campaign trail to legalize marijuana and use a potential $300 million tax revenue to fund education programs and workers' pension. Legislators there are taking him at his word, with State Senate President Stephen Sweeney saying he wants to call a vote on a draft bill that was written in May and get it approved within 100 days of Murphy's inauguration on January 16th. Murphy did not return a request for comment to this article, which is from CNN Money. Did I say CNN Muddy? That's not what I meant. Getting to $300 million in tax revenue could take some time. The uncertainty at this point is how long it will take from the legislation being signed to stores selling products, said John Whitten, spokesman for the New Jersey Policy Perspective, the think tank that's making recommendations on the recreational marijuana infrastructure. I assume they're in New Jersey because it's called the New Jersey Policy Perspective. I would assume that probably has people from different think tanks around that have had successful programs in other states. Some industry folks are suggesting at least 1 year to write the regulations, so bottom line, $300 million a year in tax revenue isn't likely until at least 2020, but more likely 2021. And they're just using that. They don't have a clue. I mean, here in Colorado, California, Washington, Oregon, we've been off by the amount of money that we thought was going to be made with cannabis. We reached $1 billion already in sales this year in Colorado at the beginning of October, a month ago. Something that a lot of people thought was the craziest idea. Like, are you kidding me? This market's not going to be that much tax? No way. We already saw it with Governor LePage talking about how regulation wasn't going to be able to be sustainable in Maine because they're not going to make enough money. Bullshit. Well, you let a bullshit. We let an actual factual shiatsu through there. Maybe we should take a hit on that one and not just taking the hit game on shizzes and farts. If you're missing what I'm talking about, we play games like take a bong hit whenever somebody says something or do whatever. I think it's been a long-standing thing to take a bong hit on the farts and the shizzes. An actual shiatsu just got through on that one, so maybe we just take 2 on the actual words getting through. I'm sorry, I'm wasting your time with redonkulousness here. Why else would you listen to me, though? Getting $1.2 billion in annual sales by 2021 could be optimistic, which is what they're talking about with the $300 million a year in tax revenue. But the point being, they should just use the term a shitload of money. A crap load of money is how much we're going to make in tax revenue, because none of these numbers are usually correct. They're not even sometimes in the ballpark of what these places are making. Kate Bell, the New Jersey specialist for Marijuana Policy Project, thinks these analysts could be underestimating the market because their data is based on federal government polls that showed only 4% of residents claim to use marijuana. Once again, backing up my reasoning that these numbers are absolutely ridiculous, and why I'm still concentrated on the numbers right now is ridiculous, and we should move on from that, probably because I'm reading a CNN Money article. We'll pick back up again. A study from New Jersey, United for Marijuana Reform Pro-Legalization Group, and the New Jersey Policy Perspective recommends a phased tax starting with 5% sales tax the first year, followed by a 15% the second year, and a 25% tax the third year. In other states like Colorado, high sales taxes scared away many customers who continue to make illegal purchases. This is also an echoing story that we're hearing out of California. Now, it's besides the slow rollout of local municipalities and the stories that talk about that, easily, by far the number one story is how high the taxes are going to be with legalization coming through in California. And it just defeats the purpose of trying to break away from the black market. It is the number one thing in a regulated market that is going to contribute to the black market is prices. And 25%, adding 25% on top of that, which is pretty much what we're dealing with here in Colorado. And they've talked about even raising that tax a few times here in Colorado. I think it gets knocked down, but it's still something that we could see go through here in California. 25% is the upper level of taxes that you're going to be able to make a program work with and still not see insane problems from the black market poking through. And I say insane problems, that's just a word that came to mind there, with avoidable, in quotes, problems that come from the black market with taxes being that high. I mean, you can avoid having that large of a black market and the problems that come with the large black market by having the taxes lower. You're still going to see problems across the board. And you're never going to eliminate the black market completely, but there are things we can avoid, like not having 25% tax, 15% tax. For us here in Colorado, that sounds reasonable to me, having a 15% tax across the board when we see things, up at 25, 30%. It's why people here in Colorado keep their medical marijuana card for the most part. Access to cheaper cannabis, having that basically your sale cut in half, the price of your sale cut in half by buying medical in a lot of places here in Colorado. And I want to see that happen everywhere, because we talked before on the show about having a sustainable business model when it comes to regulation, and that too high of taxes, it's not part of the sustainable business model. Lawmakers should set a tax rate that promotes public safety and keeps participation in the illegal market as low as possible. After legalization, said this study, which didn't examine other types of taxes, just sales tax. We're talking about the study done in New Jersey by this policy group. Even if legislators set a competitive tax rate, building the infrastructure for New Jersey's legal marijuana industry won't be easy and won't happen quickly. Medical marijuana already legal in New Jersey, but there are only 6 dispensaries serving a state of 9 million people. It's also has to be said when that line is read is that we've dealt with the Christie administration before, that it's had a cap to it, that you've had you've had people putting their hand on top of your heads and not letting you stand up and not letting you grow and succeed. So think about that first. So let's not use too many examples from the previous administration. Give these pro-cannabis people room to run with and room to do what they would like to see done. Because it sounds like they want to do some great things here. 8 states and Washington, D.C., blah, blah, blah. 5 states already started up retail markets, blah, blah, blah. New retail businesses may open up as well if they can negotiate the complicated regulatory process. If the state moves quickly to legalize recreational marijuana, and if they allow the medical dispensaries an early start in selling adult-use pot, which was an idea that was thrown into the mix too, that I think I forgot to mention that earlier. You could see sales as early as 2018, but it would take longer to set up new stores. So one of the options that they have in New Jersey is allowing these 6 medical marijuana spots priority and, kicking them licenses right off the bat. Since they've already passed the process, if the state can come to an agreement, the state legislature can come into agreement on this. You have to understand with this, ladies and gentlemen, that, and I don't know if it's not that much of a difference, but we have completely avoided the public vote on this. That the sometimes overburdening framework that comes with a vote that, how do I want to put this? Okay. In order to have a successful vote go to the people, it has to be worded correctly. And sometimes that wording can get in the way later of regulation. State lawmakers and regulators' hands are tied to the framework of what the state voted on. This is completely starting from scratch. This is your legislators, your lawmakers there, starting from scratch, having the ability to create whatever they want with the will of the people. So you speaking up, having your voice heard, going to the hearings they're probably going to have over the next year or so, having that public input is so huge and important in this. I mean, I can't think of another time besides here in Colorado in 2009, we had a situation to where the it wasn't even the Marijuana Enforcement Division at that time. The health department was trying to shut down dispensaries. They were going to limit your caregivership to 5 people, and it would have effectively shut down dispensaries. People came in, voiced their opinion. Thousands of people showed up to this meeting. It changed the direction of how things happen here in Colorado by showing up and having your voice heard. You can have 50 lawmakers in a room discussing something, trying to do the politically correct thing and save their careers. And that's how politics works across the board, because rarely anybody shows up to have their voice heard from the public. But if you show up in droves, 10, 20, 30, 40, 100, 1,000 people, 2,000 people showing up to these meetings saying, even if it's the same thing said 100, 200, 1,000 times over and over and over, the more times it's repeated, the more times it's said to these lawmakers, the more they're going to feel comfortable with moving forward on what you've said. It's not just some crazy idea to them. They're not thinking on the drug war attitude that they thought for their whole career. It's setting a new standard. It's what I've talked about before with lawmakers and politicians not being comfortable with being anti-drug, or at least anti-marijuana anymore. That if they are anti-marijuana here in Colorado, California, Oregon, Washington, that you're probably not going to keep your job for too long. This is going to start happening in places like New Jersey, and it's up to you, who I can understand have felt disenfranchised for so long that you don't want to get involved into politics. You hate the law. You hate politics. I get it. But with this, get involved. Show up. Have your voice heard, because this is exciting. Having New Jersey possibly have legalization. This would be the first time anywhere in the United States that the state legislature would create a legalization law from scratch. It's amazingly exciting and awesome, and it sounds like it is absolutely going to happen. It may not happen in the 100 days. I think back on Canada's promise, Justin Trudeau's promise of legalization in Canada immediately is the first thing I'm going to do is legalize weed in Canada. And here we sit still, no legalization in Canada. And as rules start to unfold for that, we just seem crazy with what they're doing with some of the limiting rules there. But we'll talk about Canada more in the future when they get closer. But with this looking like it's going to happen, it is awesome for people in New Jersey. So we'll stay in touch with this and keep you updated on the rollout. The important thing to keep updated with is, like I said, those public hearings, the public comment sessions that are going to be everything in how your law ends up. If the law does not end up like you want it there and you didn't show up to voice your opinion, nothing can be said. Nothing can be said from your side. Seriously, it's so exciting that this is something that people in New Jersey get to be a part of.
You're listening to the John Doe Radio Show.
Something that's evolving a lot slower than I think a lot of people would like is testing in regards to pesticides and molds and all that other stuff. But specifically what I'm talking about here in this story is the accuracy of what the percentage of CBD or THC, etc., the cannabinoid testing percentage or milligrams in a lot of the cases. Like here in Colorado, they have to come in milligrams. How accurate that is, and how accurate the label with how much you're getting actually is. First of all, we have to talk about and note there is a very large difference in results between labs. So depending on what lab you use to do your testing, you may get a completely different result from that lab to the next. One of the biggest reasons for that happening is because the labs don't talk to each other. They're not working together to try and find a base like happens in science. And it's extremely frustrating because you want to be able to give consumers the best product possible and the most information and the most accurate information possible for the product that they're consuming. I don't know why, but for some reason, this is something I thought we would move a lot quicker on. I thought testing models would be work together among the labs a lot more than they are. But that was a really naive idea to think about, because really when it comes down to it, a lot of these procedures and a lot of this testing, even though it's based in, the chemistry and science that has been there forever, and the thing is, the procedure to get to the end point hasn't. So these proprietary procedures and these proprietary rules and processes that these labs are getting into can be extremely valuable to them. So to share this information among labs, it makes it very hard for them to do that because of monetary reasons. And then also there's legality, etc., that go along with it. And we'll get someone from labs on here, from a lab or a few different labs, and discuss this exact thing, with them, because it is something that I wish we would all work together a little bit better on and get to a point to where some of these percentages of milligrams that you're getting as a consumer are more accurate. Because it's going to become a problem at some point. And one of the articles that I have today for you too is that the FDA is tired of your shit. Specifically talking with CBD, the claims that are made with CBD, etc. Anyway, we'll get to that story. The law is not quite as black and white in the legal states regarding marijuana extracts such as CBD. It's one of the active ingredients in cannabis. Increasingly, though, the offer of wide-ranging health benefits with few side effects or addiction or abuse is something that people are turning to CBD to use. Sorry, I was trying to paraphrase that CNN paragraph there, which they told you the same thing that every other article starts off saying: how many legal states, blah, blah, blah. More and more evidence is coming out that CBD can be helpful for a variety of conditions, from anxiety to inflammation to seizures and epilepsy, says Marcel Bon Miller, an adjunct assistant professor of psychology and psychiatry at the University of Pennsylvania. No surprise, dozens of companies are jumping on the proverbial bandwagon, peddling these products to consumers who have high hopes that they will help treat a myriad of ailments from chronic pain to PTSD. Even though medical marijuana is legal in more than half of the U.S. states, it remains illegal under federal law. As a result, the FDA does not regulate derivatives of the plant, including CBD extracts. Bon Miller believed that a synthetic evaluation of the products on the market was needed so consumers would know exactly what they were buying. It's the wild, wild west, he says today. For a study published in the Journal of American Medical Association, Bon Miller and his team bought 84 commercially available CBD products on the internet and had them chemically analyzed by an independent lab. The researchers found that only 31% of the tested products contain the precise amount of CBD advertised on the label, within the acceptable margin of error, while 26% contained less CBD than the label indicated, and 43% carried more. That was what was surprising to me, because here's something here in Colorado makers of products have to deal with, makers of edible products have to deal with. You have a certain amount that you can't go past, like 100 milligrams on the recreational side, for instance. Now, if you go past 100 milligrams, there's, I think, like a 10 or 12% margin of error that you can have with that. But most companies are not even going to try to, they have no incentive legally to hit that 100 milligram mark directly on, because what if, as I've said before, when we started talking about this, the labs test differently. One test can come out differently than the next test. And definitely the tests differ between each lab's use. So what if the state's using a different lab than what you use to test yours, and it comes out above that acceptable mark, and they end up recalling your whole product line? Everything's got to be shipped out of these stores, and that's going to cost you a ton of money. Companies have seen that when it comes down to like pesticides and other things. So there is no incentive for a company to be really even close to that, other than serving their consumers. Multiple times here in Colorado, there's been rules, there's been rules to address this, and edibles, the changing of, you can't have bears or gummies and things like that. Those rules have been put into place, but as far as the lab and regulation side of things, we've been very slow to encourage any movement with that. The last encouragement of any movement for labs here in Colorado that there's been is that they punished a few different labs for not having these procedures in place, for pretty much not operating like a lab and just shooting from the hip and half-assing testing products. So I think it was like 41 violations for can labs the state gave them, basically having no scientific procedure for testing any of these products. So that's what we're trying to avoid, and what we're dealing with in trying to reach the next level with some of these products and serving the consumers. So let's just get back to the article here. What I was saying about the articles before previously I had read, finish up my train of thought there, is that there's what this guy is talking about here has already been proven multiple times in multiple places, including here in Colorado. Westward did an article starting of years ago, like when we first started having edibles and testing and rules came into play. They went and got a bunch of edibles, tested those, and almost none of them were even close to the percentage or the milligram that was advertised on the front of this packaging. So are you getting what you're paying for? That's the incentive for these companies. But when the incentive is just that and the consumer is generally happy with their product, and if they go over, they could be shut down, not really a lot of incentive for them to help serve you on that side. If you're happy, you're not bitching, fine. Accuracy of labeling, it turned out, was also associated with product type. About half of CBD extract oils were labeled inaccurately. Nearly 90% of vaporization liquids were labeled inaccurately. Tinctures, alcohol extracts, were roughly equally likely to be over, under, or accurately labeled. Was Von Miller shocked? No, he wasn't shocked. Was I disappointed? Yes, he was disappointed. It just got him thinking, we need oversight in this industry. It's one thing on the recreational side, but here we're talking about something that people are using almost exclusively medicinally. You don't get high off of CBD. And what's crazy is that he's surprised that that's a thing, that the medical or testing side is not being concentrated on more. Here in Colorado, recreational testing rolled out well before medical marijuana testing. In fact, they're still trying to roll out testing, labeling on the medical side for concentrates and edibles here in Colorado. And it makes a lot of people wonder that why recreational was the first to get taken care of with that, but then medical marijuana was left on the back burner. I mean, it's a priority. Really, I want to say that they don't care. Well, I don't really want to say that they don't care and that they're just like a machine working through this, but that's what's happening. The government, regulators, lawmakers are working through this like a machine with everything else they've done. It is up to you as the activists and as people who care about this industry to build businesses that are responsible, to be active and show up and have your voice heard and change those laws and inform lawmakers, even if you're not necessarily trying to have a law changed in one of these public hearings where you can go and have your voice heard. One of the important things is educating these lawmakers and helping them understand the cannabis culture a little bit more and helping them understand how things work. Most of these people are clueless to how cannabis culture operates, to the things we do, to what needs to happen. You know, hopefully more and more places like Colorado and California, Oregon, Washington, hopefully in those places, lawmakers are becoming more and more versed on this, but it's because of people like you showing up and telling them how it happens and informing them, educating them. Otherwise, they don't have a clue. And it helps them get over their drug war mentality and their fears of cannabis. That's what made another finding from the study stand out. Concentration of unlabeled cannabinoids was generally low. However, THC was detected in 18 of the 84 samples tested, according to the paper. THC, or tetrahydrocannabinol, cannabinol has its own medical applications, but I don't know why I laughed when I read that. It's just funny to see it typed out completely in a news story. Maybe I'm just high. I don't know. Anyway, unlike CBD, is psychoactive and can cause a high. Unknowingly ingesting THC could result in side effects such as trouble sleeping, cognitive impairment, could also have unintended consequences such as positive drug tests. That's really what they should have led with in that paragraph there, is that when people are ordering some of these products, which it is very, very important to explain to you that if you are getting these products shipped to you, that they may be being pitched as 100% CBD product, but when it is derived from a cannabis plant, or if they're, let's just avoid all the even scientific mumbo jumbo. This is not a clearly 100% scientific regulated process. It is possible for THC and other cannabinoids to get in because of how still wild, wild west some of this is. All right. Not everybody that's producing these concentrates and producing these products is following the same steps to get to the, for lack of a better term, the perfect product of what they would like to be out there. There are hiccups and there are quirks in the process that could have anything involved. So be careful with that. And it's also something that could get you into trouble if you haven't it shipped from another state. You know, if it tests positive for THC, or really what the DEA has said, if there's any cannabinoid derived from the plant, non-synthetic cannabinoid, if it's derived from the weed plant, then it is illegal. So it's scary to possibly navigate not only on the safety and efficacy side of these things, but on the legal side also. We'll skip what he talks about, the scary things about unknowingly ingesting THC. As things stand now, the supplement industry overall is not regulated. CNN chief medical correspondent Sanjay Gupta said, "You don't always know what you're getting, how much you're getting, or even if the active ingredients are in there at all. With medical marijuana, it is almost the opposite situation. At the federal level, it is highly regulated." Bond Miller said increased regulation is exactly the kind of change he hopes his study will initiate. If the FDA regulated this industry, we would be way better off, he said. They're good at regulating things. When you go and buy, this is funny, when you go and buy a prescription at a pharmacy, you know what you're getting. And when he's talking about that, they want products out there that are exactly what they say they are. When you get a pack of Doritos or a Hershey bar, you know that what that is even too. So with consumers and with what we're trying to create here in the cannabis industry, we can create these great products. We can isolate CBD. We can isolate other cannabinoids, and you can form companies off of this stuff. But it's important that we do it responsibly. And no matter what, just understand this, that this process is going to create regulation no matter what. And I don't know whether we're going to end up with regulation on the side of what they're talking about, like like vitamins and other things. You walk into a Whole Foods or a vitamin cottage or something like that. Some of those products that are unregulated and can't be claimed health efficacy on, I don't really necessarily want to head that direction with things. I don't want to have overreaching regulation and have prescription companies, drug companies come in and take over everything. But at the same time, I want things to be recognized. I want research to go into cannabis to create drugs for ailments, like not just, if there's something that we can isolate in the cannabis plant and create a product that helps address, which there's multiple studies with this, helps address pain that even opiates don't address. If we can create that with cannabis plant, let's do that. Let's have studies done on that. There's a regulatory process to toss cannabis in and to run through the trials of that. Let's work with that. I don't want to fight that. I want to fight overregulation and scare tactics when it comes to cannabis, but I don't want to fight positive movement and products and ailments being able to be taken care of with cannabis. It's just frustrating that we are involved in a situation not only with making laws and rules with cannabis, and that process gets frustrating, but also that a lot of the time we view prescription drug companies as like bastardizing cannabis possibly because of how they've operated with other drugs and because of how crappy they've treated us with prescription drugs and the lack of care and compassion that has gone into some of their products and the pricing on that side of it. I get that. I get that side of it. But there's a whole nother side of testing and creating these drugs and having cannabis in a lab that is beneficial. I think the companies that start working together on the cannabis testing side in states like Colorado, California, other places, those companies that start working together and solidifying the scientific procedure to standardize testing, those companies are going to be the ones that make the most money in the end.
The John Doe Radio Show.
The FDA gave CBD companies the FU here recently. They sent a message to companies trying to sell marijuana-based CBD products as ones that can prevent, diagnose, treat, or cure cancer with zero evidence supporting that assertion. They told them to knock it off immediately. In other words, we are tired of your shit. This is really the only thing that's echoed in my brain when I read this article or saw this headline is the FDA is tired of your shit. Substances that contain components of marijuana will be treated like any other products that make unproven claims to shrink cancer tumors. We don't let companies market products that deliberately prey on sick people with baseless claims that their substance can shrink or cure cancer, and we're not going to look the other way on enforcing these principles when it comes to marijuana-containing products, said FDA Commissioner Dr. Scott Gottlieb in a statement. I also want to make something very clear in that there is not 100% proof in everybody out there that there's not 100% proof that cannabis is a cancer cure for everybody out there. There may be incidences and stories where cannabis has diminished someone's cancer or maybe cured their cancer. But until we can prove that it's something that can happen in every single person, which it's not at this point, I don't want to bash cannabis as being a possible cancer cure or say that you're wrong or say, fark you, if you think cannabis is a cure for cancer, but I want to be realistic about it. Okay, I want to be as heartfelt and as compassionate as possible about those kind of conversations because they are very touchy but very important conversations to have with yourself and with your loved ones. It really, really does frustrate me when I see people scream cannabis is a cancer cure and just run with that and run with it like it's 100% true and there's facts and proof out there to show that it absolutely is. Because there's not. I mean, there may be anecdotal evidence and things here and there. Rick Simpson gets brought up every single time. But it's just not that way. It's just not. And I'm sorry. I wish it was. I really do. From the bottom of my heart, I wish it was. And maybe it will be. Maybe it will be. In the story that we just talked about, with everything that needs to be tested and worked on and sent off to the lab and broken down and what kind of products can we create for this in the future, maybe it will be, eventually. I really honestly do think that it probably will be. But right now at this point, from a fight standpoint, from a realistic perspective, that's just what we have to look at. And those are the things that we have to face. And the FDA said far couches. I'm going to bring this up right now. The FDA sent warning letters to 4 companies: Green Roads Health, Natural Alchemist, That's Natural Marketing and Consulting, and the Stanley Brothers Social Enterprises for claiming various products they sell online containing CBD can thwart biological processes that cause cancerous cells to spread. As medical and fully legal recreational marijuana becomes increasingly common in America, claims about cannabis's health effects have finally been getting serious scrutiny. This article says finally finally been getting serious scrutiny. By the way, this article is from Fortune.com. The medical literature to date paints a mixed picture of marijuana's effect on health. For instance, while there's no real evidence it can treat cancer, it is fairly clear that marijuana can treat nausea in cancer patients undergoing chemotherapy. Cannabis can also use to soothe chronic pain, mollify muscle issues in people with multiple sclerosis, and improve sleep for people with certain disorders in the short term, according to reviews of more than 10,000 individual studies published by the National Academies of Sciences, Engineering, and Medicine earlier this year. FDA Chief Gottlieb notes that there aren't any marijuana-derived products approved in the FDA, but there are several going through later stage clinical trials, including experimental epilepsy treatment from GW Pharmaceuticals and Zenerba Pharmaceuticals cannabis-based gel for a rare autism spectrum disorder called Fragile X syndrome. Once again, I want to repeat that it absolutely devastates me to have this conversation with people sometimes, and I do avoid it. I don't like to get online anymore and have arguments with people who say things that aren't necessarily true and run with them. You know, whether it has anything to do with a 100% clear fact that wasn't true, I just don't enjoy going and arguing with that person about it. And number one, it's frustrating to see that, but when it comes on the side of this cancer discussion, it absolutely breaks my heart and this is why the FDA controls this and has rules in place, because they don't want people to put false hope into something that isn't there. And it devastates me and it kills me. It makes me want to, cry to even think about having these discussions with people or addressing this, because it is a hard topic. But in our industry, we have to stay, for lack of a better term, sober when it comes to these claims and what marijuana can do. Not only staying sober for not giving people, false hope in some situations. And it can be a miracle drug. It can. In some situations, I'm not saying that it's not cured your cancer or not cured someone in your family, but we also need to be honest with where we're at in order to move forward, in order to have these studies done, in order to be taken seriously. Just wanted to make sure that we talked about that. I thought it was kind of interesting the FDA took this long to issue something, and it definitely won't be the last warning that they issue.
The John Doe Radio Show. One stop for your stoner fix.
A Massachusetts update, and before we get into this article, I don't know too much of how things have happened or played out in Massachusetts as far as like feuds or the politics and all that good stuff. But the headline of this article is marijuana activists, companies clash over recreational rules. And it sounds like it's a pretty decent thing for them to clash over. Long simmering tensions between activists and business wings in the Massachusetts marijuana community boiled over this week after several medical dispensaries urged the state to grant them a significant head start in the recreational market while delaying or limiting the licensure of less established players. In a controversial memo submitted to the Cannabis Control Commission, the dispensaries argued the agency must divide implementation of recreational industry into two phases if it hopes to meet the aggressive July 1st target date next year for the start of pot sales. Under the dispensary's plan, the commission at first would incorporate many of the existing rules and systems for medical cannabis, giving them an early shot at selling recreational pot. Meanwhile, the dispensaries want the state to put off licensing cooperatives of small-scale marijuana farmers and limit a program intended to boost minority participation in the industry. Activists say the proposal would undermine a key provision in the new state law granting expedited licensing to companies that would promote economic empowerment of those arrested and incarcerated for marijuana offenses at a disproportionately high rate, namely minority and low-income communities. Which is very important. That's huge. That's one of the number one goals that I have for any legislation when it comes to implementing legalization, etc. is 2 rules. Number 1, you protect the people that helped you get to this point, and 2, you have a proper business model so that the program can be sustained and businesses can actually succeed at this. The program can succeed. But that number 1 thing is becoming more and more important, and it's awesome to see this evolving in Massachusetts. And then, as I've mentioned before, it's happening in Oakland also. Just got a text message there. I love my Mario text message sound. So it's awesome to see this. In Oakland, they're reserving a certain amount of licenses for people that have cannabis offenses, etc. Same thing that's kind of happening or trying to be had here. The dispensary said those companies should receive expedited licensing only if they agree to operate as nonprofits and invest their revenues in economic empowerment initiatives. Activists called that idea protectionist and racist, saying it would simply steer more of the spoils from regulated pot sales to existing operators and well-off investors. We will not be written out of this opportunity to finally have a piece of the pie, said Horace Small, founder of the Union of Minority Neighborhoods and a member of an advisory board helping the new state cannabis commission shape the rules for legal pot. Prisons have been overbuilt over a joint. Black and brown communities have countless victims from marijuana arrests. We have skin in the game. How dare you, he says. The expedited licensing provision is widely seen as a key tool for ensuring diversity among recreational operators, a goal that has mostly eluded other states with legal marijuana industries. Here in Colorado, for instance, Wanda James and Scott Durrott, the first black marijuana dispensary owners anywhere, from what I understand. That's repeated by Wanda and Scott. And she is on a campaign currently now to draw more attention to make sure that minorities are included in this, that more ownership is given or allowed to be taken by minorities. The frustrating part about this is that it's not necessarily our community, the cannabis culture community, keeping minorities or people down. You can even include with that people that just don't have money. The people that are minorities and don't have money in this don't have access to the same cash flow lines that people who are not necessarily in that same category have. I mean, it's incredibly expensive to get things started here in Colorado and other states. I mean, you have in Arkansas, they're looking for $1 million basically to be, I don't know if bonded is the right word, but I mean, to have the amount of cash that's needed to set up in today's markets, it's astronomical. And the opportunities that were had here in Colorado, for instance, we had a super lucky and awesome period of time here where if you hear about it, it's referred to as the Wild Wild West period of time. During that time, a lot of cash was raised by people who were just growing in their basement, selling to stores, or just opened a storefront and were chunking out as much cannabis and much product as they possibly could. And then hopefully smartly, I don't know if that's the word, we just made up the JDR there. I'm sure I've added that to the dictionary before. We're putting this money away and building their business and building their brand, and are now some of the leaders in the industry. Didn't have a whole lot of investment from outside, but still made it happen by having this open market and this free reign to be able to sell and build the cash without any regulation. That's what we got fortunate with here in Colorado. And still, it affected minorities disproportionately, because once the licensing process came into play and things continue to get more expensive and costly, I don't want to get into the whole ins and outs and magnify it. I'm sure at some point in time we will have Wanda James in to talk about this and discuss what progress is being made, if any progress is being made, and what people are doing and what kind of attention needs to be paid to this. But the important part for me in this article is opening it up to people who have previously been affected by cannabis laws, by the drug war. Back to this article, expedited licensing procedures. In October, the New England Treatment Access and several other medical dispensaries, through their attorney at Boston law firm Foley Hogue, suggested the provision was ripe for abuse. Without stringent quantitative standards, we fear opportunistic applicants will present illusory? I've never seen that word in my entire life. Figures a lawyer or JDR would bring you a word that's never existed. Promotion of economic empowerment in communities of color solely to obtain a licensing advantage. The attorney Kevin Conroy wrote in the memo he declined to name his other dispensary clients. So here's the problem with that. Well, first of all, it is a legitimate concern. It is something that if you're going to have this provision in place, it needs to be protected and it needs to be probably vetted, and the application process needs to be looked at pretty stringently. And I'm sure it will. The problem with what they're trying to say is they're completely trying to eliminate everything from top to bottom, trying to eliminate this process because a couple bad apples might get through. Not even try it out, not even put it into play to see if it actually works. That's what sucks about this. People fighting against this. I hopefully would trust the people of Massachusetts to regulate this well and not have it rife with abuse. We've done a great job in other states in not allowing criminals, quote unquote, I guess you could say, for lack of a better term, criminals, no, that's the right term to use, coming into the industry and ruining it for everybody. You know, shipping off, having a company set up here in Denver, and then all their product gets shipped off to Florida. You know, things like that. That kind of stuff, because of the regulatory process we have here in Colorado, that type of stuff doesn't really happen too much. It doesn't happen at all. It's happened maybe one time that has made the news and been a big, huge deal. The VIP Wellness, I think, was the company that got in trouble with that. And they had like ties to like cartels or whatever the fuck it was. Colombian drug cartels or some shiz like that. And that's probably how it was pitched. And it wasn't even probably that serious. But we've not ran into that stuff because of how, and also in my opinion, responsible people getting in this industry are. You okay over there, Malders? My pupper's sitting next to me always as I record JDR. She's like my comfort pillow. Just reach over and pet her head. My doggos. Molly's my dog, if you didn't know that. So, I trust that these companies will... I trust that this state will be able to regulate these companies well enough to start up. Conroy defended the proposal, saying it was merely a suggestion about how to define who exactly is eligible for expediting licensing, something the law leaves unclear, and delaying the regulation of so-called craft cooperatives, Conroy said, is necessary if the commission hopes to promulgate regulations by March 15th and begin accepting applications on April 1st as the law requires. So basically, he's making up a bunch of excuses for why this should be tossed out. Conroy was the lawyer against this. We think setting up a basic licensing regimen by April should be the main priority of the commission, Conroy said, and we think other things can be done afterwards. But activists said the proposal is little more than an attempt by existing medical dispensaries to handicap potential competitors and create a second-class license for minorities. You want us to do nonprofits while you get rich? No way. We intend to partake in this industry to the fullest extent we can, said one of the activists they talked to in this article. They just randomly brought in this new activist and just gave his last name. I don't even know where he's from. He just said, hell nah. Dispensaries also want to delay licensing so-called craft cooperatives of small-scale marijuana farmers. Conroy noted Massachusetts is the first state to set up such co-ops and must do so carefully. He said without proper oversight, cultivation cooperatives could lead to a new unregulated market, divert cannabis proceeds to criminal elements, and invite a federal crackdown on marijuana operators. Pete Bernard, who led a coalition of Massachusetts homegrowers, said the dispensaries are trying to limit competition and argued craft cooperatives will provide opportunities to entrepreneurs who do not have as much capital. The people who want craft co-ops are going to speak very loudly to get it, Bernard said. This Foley Hogue thing is nothing but a ploy to get market advantage. New England Treatment Access's Director of Government Affairs said he defended the proposals, but added that an inclusive and diverse industry is critical to the success of the regulated model. Not all medical dispensaries agree with the Foley Hogue memo. Adam Fine, an attorney who represents other Massachusetts dispensaries, said delaying craft cooperatives would steer home growers to the illicit market instead of licensed entities. And limiting some businesses to nonprofit status, Fine added, is antithetical to the intent of the law, noting that a similar requirement from the state for medical dispensaries has made it difficult for them to raise funds. So not only is this something they're trying to do now, it's something they've done before and run into problems with. So these companies that are trying to limit and stop this from happening have already seen progress and already seen the benefit of limiting and keeping you out. So let's try it again. That's horrible. Fine said, why on earth would we recommend that historically disadvantaged groups trying to get into the cannabis industry be forced to use a model that will result in less capital and less likelihood of success? A spokesman for the Cannabis Commission said the agency has not discussed the question. Bless yourself, Molly. Doggy sneezing. A spokesman for the Cannabis Commission said the agency has not discussed the question of postponing anything and is committed to meeting its deadlines. Shalene Tidal, one of the agency's 5 commissioners and a former marijuana activist and entrepreneur, was even less receptive. It's hard for me to imagine a scenario where we would disregard the legislature, the general public, and the state law, all of which have been clear that the development of craft marijuana cultivator cooperatives is a priority, she said. Tidal said the expedited economic empowerment licenses is a critical tool for compensating, if only in part, those who lost their jobs, homes, children, and most importantly, their freedom for using and selling cannabis. I'll just let her drop the mic there.
The John Doe Radio Show.
I saw an article in USA Today about Las Vegas and social use, seeing how I think it's going to be the example of social use. I thought we should update you on it, a few insights and how lawmakers are thinking about the problem there. Las Vegas's reputation as a place where you can indulge your vices and have a good time helps it lure some 43 million visitors a year. But tourists heading to Sin City hoping to consume newly legal cannabis have a problem. There are few places in town other than private homes where someone can legally light up a joint. In Nevada and 7 other states that allow people to consume marijuana for fun, it's typically illegal to smoke or ingest the drug in dispensaries, bars, restaurants, city parks, and public streets. Hotels and landlords often ban people from using the drug on their property. The next frontier is, where do people use it, said Nevada State Senator Tick Segerblom. I don't know how you say his last name, a Democrat who advocated for marijuana legalization. He said that creating lounges where people can consume cannabis products they buy is the logical solution. Although lawmakers have tried, no state legislature has yet carved out rules for cannabis lounges, cafes, or tasting rooms. Policymakers in Colorado, Washington, and Oregon have struggled to reconcile proposed rules with other state laws, such as indoor smoking bans. That's going to be the massive problem that California runs into, is not just the problems with people thinking about social use and driving away and edibles and all the arguments that go into that. They have such strict smoking rules there. If places are allowed, it may be like a null and void situation where you can't really smoke there at all, or even in the back or anywhere near it, that's frustrating. Lawmakers also fear that marijuana loungers could create a public health and safety problem, which I just talked about, such as increased drug driving. That's the number one thing that comes up when we talk about social use facilities, and trigger a federal crackdown. This article says, some cities, including Denver and Colorado Springs, have created temporary rules for lounges, but cities run into the same legal issues as states. Entrepreneurs are opening up marijuana lounges anyway, creating problems for law enforcement. That's what's happened here when they mentioned places in Colorado Springs and Denver have opened up. Colorado Springs has created some rules where they've basically they've grandfathered in the cannabis clubs that exist there, but you can't smoke on that property, which I think one or two of them have closed because of that. And then over the next, 8 years, I think is what it is, that they will basically phase out those cannabis clubs if something doesn't get fixed in the meantime. So basically them saying the Colorado Springs City Council, that is, with them putting in a rule saying that you're going to have 8 years and we're going to phase out this, that 8 years is basically a handoff to the next administration, or basically punting to not have to make rules now. There's no way in 8 years, I would hope, I didn't think that we would still have no rules here in Colorado at all for people to go have social use facilities open. I would not think that we would, in 8 years, not have some sort of rules made up and that situation solved there in Colorado Springs and in Denver. I hope. That's why we're covering this, and that's why we're pushing it so hard. The 4 states where ballot initiatives legalized recreational marijuana last year may have the best chance of finding a solution. Nevada allows smoking inside many bars and clubs, for instance, so pot lounge proposals raise fewer concerns about indoor air quality. And the ballot initiatives approved in California and Maine last year opened the door to legal lounges. I would highly doubt that Maine, even with the problems they've run into with their governor, may end up with places where people can go use. I don't think they're going to end up with places where people can go smoke. That's still going to be an underground thing in Maine, but I think they may end up with places where people can congregate and use edibles and some weirdly limited model. And who knows if anybody will even open a spot there, just like here in Denver, where it's been so ridiculously limited that nobody's even really trying or nobody's applying for any of these licenses. And where were we at here in this? California's initiatives say cities and counties can choose to allow smoking, vaporizing, and ingesting marijuana at some retail stores and other businesses. Maine's initiative included rules for licensed marijuana clubs, but like I said, the licensed marijuana clubs in Maine don't include smoking or anything like that. And then the initiative that we did, the rules that California's going to have to deal with, all that said, it still has to abide by Clean Air Act. So the Clean Air Act supersedes pretty much what they tried to do there. So hopefully they can get something worked out. Clean air rules, unanswered health and safety questions, and political divisions have all stalled progress on legalizing social consumption, said Andrew Friedman, a consultant who formerly served as Colorado's director of marijuana coordination. It's just a very divisive area, he said. Even industry leaders are split on whether such lounges should be allowed. I don't know an industry leader who would not be for this. And I guess we need to round that up. I guess we need to point out who the people are that don't agree with this. I didn't think there was anybody on our side. I guess that's a naive thought to think that there's not people on our side that wouldn't want this to happen. There's already tons of other ridiculous things that come out of the mouths of people from our side. That frustrates me to hear that. Alaska law permits people to consume marijuana at a dispensary, but for a year and a half, policymakers there have struggled to come up with rules for marijuana tasting rooms, dogged by questions about air quality, how to measure cannabis intoxication, and other issues such as whether to set purchase limits or ban happy hours. In theory, it shouldn't be this hard to come up with a policy solution. The same questions that have been asked regarding public use of alcohol or smoking are the same kind of questions that get presented when talking about cannabis, said Colorado State Representative Dan Pabon. Policymakers ultimately have to weigh in on non-cannabis consumers' right to be free of the drug against cannabis consumers' right to use it, he said. But it's harder to strike that balance for cannabis than tobacco because there's not much research on how cannabis smokes affects bystanders. Cannabis smokes. Hey, man, you want some cannabis smokes? That's kind of keeping things at bay, he said. And he's not 100% correct in that. They fall back on this drug war mentality where there's no studies, there's nothing recognized, this is completely unfamiliar territory we're walking into, which in some cases it is, but There are studies, there are patterns out there that we can draw from when it comes to the health effects, problems, crashes. Currently right now, what people are trying to do with some stats in Colorado when it comes to crashes, they're trying to include marijuana in in an increased traffic fatality situation. But the trouble with that is that if you used marijuana 2 weeks before and then got in a crash and they tested you and you still tested positive, they included that into the situation. And it's just ridiculous. So what these lawmakers are saying sometimes, they're playing politics, which we have to hold them accountable to not play those politics and to move forward with these programs despite that BS. State inaction has left localities in a bind when the Clark County Commission, which has jurisdiction over the Las Vegas Strip, raised the marijuana lounge issue in September. They confused a fundamental question: does the county have the legal authority to license such lounges? The statewide ballot initiative that legalized the drug doesn't make that explicit. Days before the commission met, lawyers for the state legislature had found that localities have the authority to license marijuana lounges, but the Nevada Attorney General hadn't weighed in on whether pot lounges are legal. His office has since declined to do so, and Governor Brian Sandoval, a Republican, had said that lounges need to be regulated at the state level. So I had got very excited when I started talking to you about cannabis lounges in Vegas, because it did sound like this was going to be left up to, almost like some Wild Wild West times, quote unquote. Now, state lawmakers and a few people have caught on to that in Vegas and want to see it regulated at the state level. Basically, they were going to leave it up to municipalities that they said, you're free to do what you want and make the rules that you want with no framework. It's fine. Just go ahead and make the rules, open the spots. As long as they follow the rules in the local municipality, that's good to go. That makes some people nervous when it comes down to cannabis and social consumption in particular, because there's like rules about, like driving away and DUI, all this other stuff that factors in to making a decision about this. So it was nice to not have the state come in and say, look, we want to put some extreme rules on this. You got to work around this. But it looks like they're slowly backpedaling a little bit on that. I'm still very optimistic and very hopeful, just as we've mentioned before in this article about how the things kind of operate in Vegas, with it being, smoking in casinos and stuff like that. They don't have the indoor smoking rules and all that crap that other states do. And it's only crap when it comes to maybe avoiding marijuana consumption, because I hate cigarette smoke. I'm so fucking glad that you can't really go anywhere in Colorado besides this one damn place my girlfriend likes to go to, and how they operate outside of the clean. They don't. They just are. They just people. It's a cop hotspot too, where cops like to go and hang out. I just feel like that regulators look the other way with this place. But Fark, she still smokes. I'm trying to get her to stop. All right. The more you try with someone when it comes to smoking to get them to stop, sometimes the worse it gets. So I try to find that balance. But there's this one spot that you can go to, and they're still kind of smoking on this weird outdoor patio. But everywhere else, you don't have to deal with cigarettes. You don't have to deal with that smoke and that BS. Because I hate it. I can't stand the smell of cigarette smoke. Even when I smoked cigarettes, I couldn't stand the smell of them. And then this article goes on to talk about how Denver moved forward and what we've done here. And I've already explained that to you before on JDR, and we'll talk about it more and more again. I'm still going to get Emmett on, who helped run the I-300, who pretty much ran the whole thing, I should say, I-300 campaign here in Denver, which allowed for social use, but then the city council came in and regulated it in a way which choked off progress from that point. So we'll talk to him, get his perspective on stuff. I know I keep telling you that we're going to have him on, but it's locking down a time that we both are good to go. And that's the trouble I'm having with scheduling these interviews, is what time I'm available outside of work and time other people are available outside of work. So I've already explained to you how Denver has got to this point with no social use, how Colorado has. And in fact, I explained it to you better than this article does, because they kind of mix up a few things and we just don't want you to get mixed up. All right? We'll stay on top of the social use thing, because why we don't have it yet, fuck.
John Doe.
That's going to do it for this week's JDR and news. Thank you very much for joining us. If you would like to get in touch with me, you can always holler at me on Facebook. My name is Tim Martin on there. I'm sure you can easily find me. You can hit us up on the John Doe Radio Show Facebook page. We have Twitter. We have all that good stuff. Or if you would like to sign on to help sponsor the John Doe Radio Show, or you have a product that you would like to give away, hit me up, johndoeradio@gmail.com, and we'll get that done for you. Have yourselves a fantastic week, and until we meet again, I'm John Doe. See ya.